Welcome to Public Health Pulse, your one stop destination for insights, updates, and discussion on the most pressing health issues that shape our communities. This January, we are spotlighting National Glaucoma Awareness Month, a time to raise awareness about the silent thief of sight. Glaucoma is a leading cause of irreversible blindness, but with early detection and treatment, its impact can be minimized. So, subscribe now and let's work together for a healthier and more informed future. So, today I will be presenting on the topic Glaucoma Unveiled, illuminating the path to clearer vision in India. This presentation highlights the challenges and opportunities in managing glaucoma. So let us dive into this critical issue and explore how we can make a difference. So first let's understand how glaucoma is caused. So our eye continuously makes aqueous humor. So as new aqueous humor flows into the eye, the same amount should be drained out. The fluid drains out through an area called the drainage angle. So this process keeps the pressure in the eye, which is the intraocular pressure, stable. But if the drainage angle is not working properly, the fluid builds up inside the eye, which rises the pressure inside the eye, which in turn leads to the damaging in the optic nerve. So optic nerve is made up of more than 1 million tiny nerve fibers. So as these nerve fibers die, the person develops blind spots in the vision. The person might not notice these blind spots until most of the optic nerve fibers have died. If all the fibers die, then the person becomes blind. Now let's move on to various types of glaucoma. So there are majorly two types of glaucoma: open angle and angle closure. So let's first discuss about the open angle glaucoma. So this is the most common type of glaucoma, and the fluid drainage in the eye becomes insufficient, which causes a gradual buildup of the intraocular pressure. So this damages the optic nerve over time. It is often asymptomatic in early stages, so there is no immediate vision changes or pain, making it harder to detect without regular eye exams. Now let's discuss about the angle closure glaucoma. So in this type of glaucoma, the iris is positioned too close to the drainage angle, which is potentially blocking it. So the acute attacks occurs when the drainage angle is completely blocked, which causes a rapid rise in eye pressure. So symptoms of acute attack may include severe eye pain, nausea, blurred vision, and seeing halos around the lights. So, the acute angle closure glaucoma requires immediate medical attention to prevent permanent vision loss. It is common in individuals with narrower drainage angles or anatomically predisposed eyes, and it can be triggered by dilating drops, dim lighting, or stress. Now let's move on to the epidemiology. So first let's understand the magnitude of the issue. So it is estimated that 12 million individuals in India, they are impacted by glaucoma, and with 1.2 million suffering from blindness, which is caused by this condition. So glaucoma, it represents 9 to 12% of all the blindness cases in the country, and the prevalence is likely to rise due to the aging population and increased life expectancy. Now roughly 90% of the glaucoma cases, they go undiagnosed, rendering it a silent epidemic within the community. Factors such as lack of awareness, insufficient screening programs, and the asymptomatic nature of the early stage progression, it contributes to this significant undiagnosed rate. Moving on to the challenges in glaucoma management. So let's look at the key challenges in glaucoma management. First, there is lack of awareness among the general population. Second, 90% of the cases they remain undiagnosed due to the asymptomatic nature of early glaucoma that we already discussed when we were talking about the types of glaucoma. Third is that the rural areas they face significant challenges in assessing affordable eye care. And finally, lifelong treatment compliance remains a hurdle due to cost, forgetfulness, and side effects. So all these challenges they underscore the need for a comprehensive strategy to tackle the glaucoma effectively. Now, how can we raise awareness? So the raising of awareness is the first step towards combating glaucoma. Public education should not be limited to the occasional events but should also be an ongoing effect. Hospitals can serve as information hubs through brochures, videos, and QR codes. Community level campaigns supported by social media and mass media can emphasize the importance of early screening and the asymptomatic nature of glaucoma. Collaboration with local doctors and ophthalmologists can further enhance the outreach efforts. Now, how to increase the detection rate? So, early detection is critical in preventing the glaucoma related blindness. Opportunistic screening during routine eye checkups is a cost effective way to identify the cases. So, we have to train optometrists or ophthalmic assistants so that they can expand the screening net. While technologies like AI and teleophthalmology offers promising solutions for reaching undeserved population. Special attention should be given to a high risk group such as individuals aged 40 and above and the first degree relatives of glaucoma patients. Moving on to how we can enhance the diagnosis. So, accurate diagnosis is essential for effective treatment. Unfortunately, many cases are misclassified due to the reliance on a single parameter like intraocular pressure. Comprehensive ocular examination and algorithmic diagnostic approaches can reduce errors. Differentiating between the glaucoma types such as the primary open angle glaucoma and closer angle glaucoma is crucial because each requires distinct therapeutic strategies. Now let's discuss how we can improve the accessibility. Accessibility to eye care services remains a major challenge, especially in rural India, where 65% of the population resides. So the government of India's PMBJP scheme, which is the Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, provides affordable generic glaucoma medications. But awareness and availability needs to improve as well. Additionally, diagnostic services must be made affordable with schemes like Ayushman Bharat covering the glaucoma related tests and treatments. Bridging these gaps is vital to ensure equitable access to care. So now let's discuss about how we can address the compliance. So treatment compliance is a significant challenge in managing a chronic condition like glaucoma. So factors such as high cost, side effects and forgetfulness impact the adherence. So educating people and patients about the importance of lifelong treatment and providing counseling can improve compliance. Simple interventions like reminders for appointments and medication refills can make a big difference in adherence. In conclusion, glaucoma is a major cause of irreversible blindness and can be managed and prevented with timely intervention. Collaboration among public health, medical, and government sectors is essential for providing education and resources for early detection and treatment. Advocating for awareness encourages regular eye exams, particularly for high risk individuals. Additionally, improving the access to affordable eye care and ensuring treatment adherence can significantly lower the incidence of glaucoma related blindness. Thank you.